Good afternoon, and welcome to all of you to this webinar on sustainable changes to make your community age-friendly. What's possible? I want to apologize for our slight delay here this afternoon as we dealt with some technical issues, but hopefully you've all been able to get in. The chat room has the number that you should call in if you have not been able to do so far. My name is John Feather. I'm the CEO of Grantmakers and Aging, and I'm pleased to report that this funders-only webinar has 82 registered participants, so the interest in this area continues to grow substantially. Before we begin today, I want to thank the Pfizer Foundation and United Way Worldwide for their support of this webinar, which allows us to provide this to you free of charge. I also want to thank Barbara Greenberg and Jan Schwartz, who have worked diligently to create the funders group and organize this session today. The growth in age-friendly communities has been amazing all around the world, but now we face a larger challenge. Once the initial enthusiasm wanes, how do we keep the momentum going? This is a particularly important challenge in this case because the time frame we need to accomplish the work to build age-friendly communities is measured not in months or years, but in decades. And what does sustainability really mean? Is it only about raising more money, or are there other parts to it? And what's the role of funders in this process? We'll be answering all those questions today, and I'm very pleased to have my colleagues who have participated in Community Agenda, a project that many of you know about that has been administered by GIA and supported by the Pfizer Foundation over the past 3 years. Because we have several presenters today, I will only briefly introduce them, but we want to make sure we have plenty of time for questions and answers at the end. So I'm pleased that we have with us my colleagues Amy St. Peter of the Maricopa County Association of Governments in Phoenix, Peter Wood of the Health Foundation of South Florida and Miami, Cathy Boyer-Shesol from the Mid-America Regional Council in Kansas City, Phil Stafford of the University of Indiana and Indiana Grantmakers Alliance, and Kathryn Lawler from the Atlanta Regional Commission. So as we start that process, if we could have our next slide, please, and our first presenter, Amy St. Peter. Amy?
Thank you so much, John. We're just so excited to be able to participate in this project as well as in this webinar today. So thank you so much for all of your support. Today I'd like to talk a bit about how our project was really, the seed for our project was really planted by one of our local foundations here, but is being supported by a wide range of different funding sources as well as talented partners throughout the region. And so you can see on the slide that really partners create the results. And the main partners, so I represent the Maricopa Association of Governments. You see our slide on the bottom, right in the middle, and the Piper Trust is right next to us. These were the people who initially started this work, but as you can see from the slide, a number of different very talented people have come in to assist in very important ways. The Maricopa Association of Governments itself is a metropolitan planning organization as well as a council of governments. Those are kind of different words that basically mean that we're the regional planning agency for Maricopa County and the greater Phoenix region. Most of the work that we do is in transportation. We also have a human services division of which I am the manager. We've been partnering with the Virginia G. Piper Charitable Trust in a number of different ways. Of course, one of the areas that they address is older adults. They do not fund transportation projects. So in some ways, we're kind of unlikely partners, but we've been able to do very impactful work because we're both willing to kind of evolve and step into different roles. 5 years ago, the Piper Trust approached us with a very specific tool and a very broad goal. The broad goal was how can we improve the lives of older adults in our communities? And the specific tool that they brought forward was the Aging Well Community Engagement Toolkit. And it contained a number of different ways to engage the community, such as focus groups, interviews, surveys, community forums, things that we had done in different pieces, but never before in a very comprehensive way, a very targeted way. At the same time, at MAG, we were conducting surveys with our local governments who are our member agencies, and resoundingly, they were telling us that they were increasingly concerned about the funding that had been cut during the recession to programs that serve older adults. And so working together, we've started the Arizona Age-Friendly Network. The goal of the network is to better connect older adults with people of all ages in their communities. And not surprisingly, one of the number one needs is transportation. That's how we've been able to embed this work within MAG in a very sustainable way. We've brought in a number of different partners who each bring in different areas of expertise. The logos that you see on the right-hand side of the slide, Central Village, Tempe Neighbors Helping Neighbors, and Northwest Valley Connect, are the first 3 pilot sites that we were able to engage. And they have all launched, and they're showing very significant impacts right now. So the Piper Trust came in with an initial investment that has decreased in terms of the monetary value. Their support, though, overall has remained the same. And in addition to the grant, they also provide significant guidance and technical expertise in evaluation. Some of the impacts that we're seeing from our initial pilot sites include assisting more than 400 people with their transportation needs. One of our villages in Time Bank, Central Village, offers 370 different kinds of services. Concrete services are being offered daily with more than 2,000 hours logged in their Time Bank. So very specific ways that essentially neighbors are helping neighbors through an investment made by the local foundation, but supported by a wide range of people, including older adults themselves, the community residents. 2 of our pilot sites are currently receiving funding from local governments, and another one is also in the queue to receive federal funding, which is very sustainable for the long term. All 3 are also receiving support from other local foundations beyond the Piper Trust. So I think this example is a great way to demonstrate that foundations can be very proactive in reaching out to others, some unlikely partners, and really be able to do some very impactful work and to have their giving amplified and magnified by other people across the region. Some of the impacts that we're seeing decreased social isolation and increased access to services and social opportunities. All of this work is being measured with a wellness survey that the Piper Trust helped us to develop. Our local pilot sites then are carrying out. This work has also helped the foundation itself in a very direct way, because they know that the pilot sites that we're working with, the 3 initial pilot sites, as well as the 6 more that are up and running now and just getting started, are all being very well vetted, very well supported, and they're increasing their capacity. So when they individually approach different funders, they know that as a result of working with the Arizona Age-Friendly Network, that they've got what it takes in order to succeed. I would like to offer to you that if you'd like more information on this, please feel free to visit Connect 60 Plus, Connect 60 Plus, spelled out, .com for more information. And John, I know that we've limited time and some great other presentations coming up. If there are no questions, Sean, I would defer to the next speaker.
All right, we're going to hold our questions and answers to the end, and I'd like to remind everyone that you see a Q&A box in the upper left side of your screen. You can go ahead and start typing your questions in at any point. I will be asking them of the speakers as we come to the end, but we're going to go ahead and go through all the presentations first at this point. So as we move to the next slide, if we could have Pete Wood come on from the Health Foundation of South Florida. Pete, tell us about what's going on in Miami-Dade.
Thank you, John. It's an honor and a treat to share with fellow funders interested in making their own communities more age-friendly some of our work. I'm speaking today as a representative of Health Foundation of South Florida, a regional health-focused funder located in Miami. Look us up on the web if you'd like more information about the foundation. The focus of my remarks deals specifically with Miami-Dade County in our collaborative work with our Parks Department to better meet the needs and interests of over 500,000 older adults living in the county.
And if we could have the next slide, I'm sorry.
Yeah, next slide.
There we go. Go ahead, Pete, I'm sorry.
I'll cut to the chase and provide you with a glimpse. So are you on the second slide?
Yes, the transformational age-friendly change.
Okay, perfect.
Yeah.
I'd like to share with you a glimpse of what we have accomplished thus far, with an emphasis on those things that are sustainable. First, we have now an executive leadership within the Parks Department that understands, appreciates, and is committed to better serving older adults. The department has researched best practices, carried out an older adult park access improvement plan, and for the first time has a Parks Department staff person exclusively dedicated to planning and monitoring the park's efforts to serve older adults countywide. There is now an array of evidence-based healthy aging programs available in parks throughout the county, programs such as enhanced fitness, chronic disease self-management, walk with ease, and matter of balance. These programs are really top quality and make a big difference in the lives of older adult participants. The county has established an age-friendly park designation process. That is an assessment and a designation process that individual parks can pursue, and if they have the right stuff, can receive recognition and promote themselves as meeting the core standards in being an age-friendly park. Lastly, there are now, and for the first time to our knowledge, specific capital improvement projects that are scheduled that will enhance park infrastructure specifically to meet the needs of older adults. Next slide. How do we go about doing this? Our first level of engagement with the Parks Department focused on getting parks to be places where older adults can participate in evidence-based programs critical to maintaining quality of life. This led us to supporting training of park staff, both in the areas of programming, but also in infrastructure related to better serving older adults. Subsequently, we've ended up funding 9 fitness zones in parks across the county. Fitness zones are essentially a cluster of outdoor fitness equipment, like the one you saw in the photo of my first slide. They can be used by people of all ages, but are really perfect for older adults and are great for muscle strengthening and an essential component of exercise for 60 plus. We created partnerships between the Aging Service Network. For those unfamiliar with that term, think about senior centers and other organizations specifically serving older adults. So we set up partnerships between that Aging Service Network and the Parks Department so that these community-based agencies would provide older adult programming at park facilities. We've supported planning both department-wide as well as with individual parks. And lastly, we involved park staff in county-wide planning and county-wide planning process to make the entire county more age-friendly, and they've been great participants in that county-wide effort. Next slide. So the most important question, perhaps, is, are older adults any better off as a result of this work? And it's our sense is the answer to that is yes. Thanks to enhanced marketing efforts, older adults are now more aware of park offerings and are less likely to see parks as places just for kids. Pedestrian access to parks has improved, and perhaps most significantly, the quality of life or the quality of park programming and infrastructure has substantially improved older adults, and as such, older adults are benefiting from these sustainable improvements. And then, I guess, lastly, by prioritizing future funding allocations, we're hopeful that additional enhancements are indeed forthcoming. That concludes my overview of an update from Miami-Dade County, and be glad to address any questions at the end of the program.
Thanks very much, Pete. And now we'll move on to Mid-America and Kansas City on both sides of the river. Kathy, would you update us on that?
Great. Thanks, John. The example of the sustainable outcome in Kansas City that we're going to share today is an age-friendly project with our local jurisdictions. And you see on this slide, wanted to say that before describing this project and our sustainable outcomes, beginning in 2008, the age-friendly community work in Kansas City was being overseen by a local nonprofit. And in 2012, the KC Communities for All Ages and I'll refer to that as KCC going forward. The project transitioned to the Mid-America Regional Council, which is commonly referred to as MARC, the region's planning organization, much like the way that Amy described the Maricopa County governments. As this webinar is focused on sustainable programs, it's important, I think, that I add that placing this initiative in our regional council laid the groundwork for working with local jurisdictions and was a tremendous factor in enabling our sustainable outcomes with cities. This slide provides a snapshot of MARC, as I mentioned, an association of city and county governments. And since I can see that it takes a while to move the slide, if you'll move the slide now, MARC covers 2 states, 9 counties, and 119 municipalities. By placing the KCC initiative within MARC, it became connected to a much broader organization that conducts regional planning and oversees other related regional initiatives such as transportation, our Area Agency on Aging, our research services, for examples. The most important connection to our sustainable work was to partner with another MARC initiative, which is the First Suburbs Coalition. And I don't know how much you can see the slide, but embedded on that slide in the little red names are the names of the 19 communities that are the first-ring suburbs. Elected officials from these communities readily agreed to partner with us to develop tools and resources to meet the needs of their projected increased 65-plus population. As a MARC initiative, it allows for a much more comprehensive effort to work on age-friendly initiatives. So now I know that the other slide is perking on its way over. So over the past 3 years, in partnership with First Suburbs Coalition, we collectively developed a toolkit for elected officials and city staff with strategies to increase their age-friendliness in transportation, housing, public spaces, communication, to name a few of the topics. A checklist of age-friendly characteristics was developed based on the checklist of essential features of age-friendly cities, and finally a Communities for All Ages recognition program where cities may apply for 3 levels of recognition, all that demonstrate they've taken steps to become more welcoming to residents of all ages. Examples of how this work has led to sustainable outcomes include, first, changes in attitudes and engagement. Through an intentional awareness component of this work, elected officials have engaged in discussions that would not have occurred, at least not for several more years. There's a quote on the slide from one of the city staff that speaks to this, but I think all of our communities would mirror that quote. Presentations are given to city councils, planning commissions, and other city commissions and committees, as well as residents of all ages, to inform them of the demographic changes facing their communities, and not just the older adult population shift, but a more diverse population as well, and the opportunities and challenges that they'll face as a result of these demographic shifts. The changes in attitudes and awareness have led to the second sustainable outcome, action and incorporation into existing plans. For example, city councils have approved resolutions in support of their commitment to engage in this work. Some cities have engaged in intentional staff development of all staff, which includes public works, community development, parks and recreation, administration, police, and fire, and that's staff training on the checklist principles. 2 cities are currently incorporating the age-friendly principles in their long-range plans, which includes comprehensive plans, parks and recreation plans, and 1 community is seriously looking at incorporating an aging lens in their public health department's community assessment. And finally, 4 cities have applied for the Community for All Ages recognition program, and since this is our first year, they've made application, and those announcements will be forthcoming in June, but each of the 4 communities will achieve the recognition that they've applied for. So each of these communities, as a part of recognition, have created a dedicated page on their city website on age-friendly topics and projects and websites so that any of their citizens can view what they're doing. Each city council has approved a resolution in support of Community for All Ages. Each community's council has delegated this work to a commission, whether it's a sustainability commission, the neighborhood commission, or planning, to oversee their next steps to move toward the next level of recognition. one community is a little ahead of the other three, has conducted a self-assessment of their checklist, and is ready to develop their action plan on how they will increase their age friendliness. So Kansas City is really just beginning to show evidence of sustainable outcomes. It's not work that is accomplished overnight. It's taken 3 years and the incredible funding from Community Agenda and our local funders from our area to reach this point. So that's my presentation, and I'll wait for questions.
And just a reminder once again that you can go ahead and start typing in your questions in the box, the Q&A box at the upper left-hand part of your screen. I will be reading these questions later on to our panel during the question and answer period. Thanks very much, Cathy, for that presentation. Phil, let's hear what's going on in Indiana.
Thank you very much, John, and thanks, Cathy, for your great work in Kansas City. I think we'll skip past my contact information, know that it's available for people that need it, but to go to I think it's important to understand that in Indiana, a good deal of this age-friendly community work has gone back several years, since 2001, and so the success of the Indiana Philanthropy Alliance in achieving participation in the Community Agenda project has been very, very helpful in moving things forward, and Indiana Philanthropy is doing significant work at the statewide level to create a statewide coalition and engage community foundations in intergenerational work. The work in Bloomington, next slide, is called Creating a Lifetime Community District. And you can go to the next slide. The goal of the project is, the goal of the project is to develop a strategy for the creation of what we call a lifetime community district designed to incentivize development along a multi-use urban trail that promotes physical, social, mental, and economic well-being for persons of all ages and abilities. The trail is a 3.1-mile segment that runs through the downtown and 8 neighborhoods in which there are 1,500 adults over the age of 50. And so our goal is to focus on public policy issues that can incentivize this community. Next slide. We feel it's important for this kind of a change effort to work in 3 different sectors. The government sector, focusing on policy issues, is what I'm talking about today. But we're also working in the civil sector, trying to mobilize neighborhood engagement, and working with in the private sector, specifically with downtown businesses and housing development community. Next slide. We feel that one of the important catalysts for doing this kind of development is housing. And there are other areas that we're working on, but I wanted to focus on housing today. Next slide. And an opportunity had opened itself up to us recently with the city's designation of a 12-acre plot as a research technology park. The little star on the slide shows the subject property, and the green line shows the Beeline Trail as it runs through the downtown area past City Hall, the Farmers Market, the Convention Center, and we're looking for all sorts of development opportunities along the trail with respect to housing, but the housing opportunity with the tech park is especially of interest to us. The tech park is being designed not only for businesses but also for mixed use and residential purposes. So the next slide. We have, it's timely that Bloomington is engaged in its 10-year review of the comprehensive plan, and so we've been actively involved in that process to infuse the plan with language around age-friendly communities with respect to transportation, housing, environmental concerns, cultural concerns, poverty, and universal design and accessibility. The certified technology part is one element of the comprehensive plan. And what I wanted to point to today was the language that has found its way into the technology park plan. And one of the redevelopment goals is to diversify downtown housing options for tech park employees and active seniors. So we've been quite thrilled and excited that senior housing is being considered as a component of the developing certified technology park. We are excited about that not only for the opportunity to develop multi-generational housing, but to help attract older entrepreneurs and in particular older artists to the downtown area, and so it represents a development opportunity that is exciting to us. And one more slide. And this is another piece of language from the master plan for the Certified Technology Park, which is to assess housing needs and demands, including workforce housing, senior artists housing, artists live, work housing, and affordable housing, and develop realistic strategies to address housing demand. So it provides an opportunity for us to intensify public discussion about the needs for a wide range of housing options along the trail, not only congregate living along the trail, but aging in place housing in the 8 neighborhoods, such as accessory dwelling units, what we're calling infill elder cottages, group shared living, and other housing options. So we're also working with local architect to demonstrate some of these and develop some posters, kind of a pattern book on senior housing. So we've got a good start going, and I think that it's found its way into written plans is one of the sustainable items that I wanted to bring attention to.
Thanks so much, Phil.
That's me.
Thank you very much for the wonderful work in Indiana. And last but certainly not least, we have Kathryn Lawler, who will bring us up to date on some sustainable efforts in the Atlanta region. Kathryn?
Thank you very much. It's a pleasure to join everybody this afternoon. You can move ahead to the next slide. I wanted to tell you a little bit about our approach to sustainability as it's evolved, and but also as we started this work, which really came from a recognition that I think all of the sites share and have done a great job explaining in their own communities, that livability and, most importantly, sustainable livability is going to require other people's money, meaning outside of the world of aging and even outside of social services, which is the world that we have been most comfortable in and have historically operated in, that being able to do this work for the next 20 years, which is the timeline that we think we are going to have to embark on to make the sort of changes we know that are necessary in our community, we have to be influencing the way many other systems spend their funds as well. So over the last 3 years, working with the Grantmakers and Aging, we've had the opportunity to do a number of different very exciting projects where we have been learning together, building bridges between other disciplines and systems and ourselves in the aging world to find our common ground, our shared language, and our way of joint problem solving. And these are just some of the areas that we've reached out to, and we've done this in some very technical ways, working on joint planning projects, also by getting our hands dirty and doing very concrete projects like putting in new street lighting together and putting in a new bus stop, building a gazebo in a community, but doing that in conjunction with these other disciplines. We've also done some data analysis, as have some of the other communities, to be able to build the bridge with economic developers to better understand the economic impact the population that we are so committed to serving, current and future older adults, is having on our metropolitan region. And we've been lucky enough to really build a strong bridge with the healthcare community through a much broader collaborative in our region that is focused on improving access to healthcare and health systems reform. And those projects have been incredibly beneficial, both in the immediate results that they have provided, whether it was a new bus stop or new access to services, but also, and I think more importantly, we've realized in the process of beginning to develop the relationships, the understanding, and some of the shared data that is influencing the way each of these disciplines listed here are spending their money in both the short and the long term. And over this last year, I just wanted to share how what our next step in doing this has been. And you could move to the next slide. And that has really begun to think about ourselves, because one of the ways that we can be powerful influencers is to reorganize our own funding, services, and supports. So for a long time, even though we are inside a regional commission, just like the folks in Kansas have talked to you about and the folks in Phoenix have shared with you, where many, many things happen in our organization, the funding sources have been thought of as very separate and distinct. They are square pegs and round holes, and they don't go together without a lot of sort of hammering and beating them into place. And so embarking on this third year, we began to understand that we had to find a way that these funding sources could become co-investors in the type of change we're seeking to make, whether that's change in housing, change in transportation, change in the way the economic development is both being planned and carried out in our region to support people of all ages and all abilities. If you can just click forward. So over this last year, we have engaged hundreds of people throughout the region so that we can move away from kind of the square peg round hole. Each of our funding sources are interesting and they can be parallel to one another, to how can we plug in together and how can we not only influence those other disciplines in the way that they are funding, but become co-investors with them. And so because we're an area agency on aging and we have many, many partners and a broad community network, we have engaged all of them over the last year in a very extensive process to better understand the needs of the community and then think about how our own funding can better align with those other disciplines and professions throughout the community. And that has really resulted in a strategic plan that will be adopted this June by our board that has emphasized a number of these things you see listed here, really focusing on our messaging to make sure that we're more inclusive and that others see the work they are doing around that is shaping our built environment as issues of livability and impacting health. Moving away from just funding direct services to also thinking about how we can fund outcomes, because the other disciplines are interested in engaging together to change outcomes, not necessarily in creating more outputs. That our strategic plan is organized in such a way as to strategically invite these new partners to the table on a more ongoing multi-year basis, so moving away from just working together on a single project to be able to invite these new partners in a strategic and institutional way. And then finally, moving to measure and fund performance, so that it is in working together across disciplines that we have to be very clear on our expectations of performance of our work, which is what allows them to plug in their work as well. So, for example, in the area of transportation, as we are seeing that most of our transportation dollars are taking individuals to senior centers, which is very important and very valuable, it really doesn't provide a way for the Department of Transportation to plug in with us as they're thinking about their short and long-term funding as well. So as we broaden what we're doing into language and into structures that more parallel the transit systems that they are familiar with funding, we're able to extend the invitation in a more concrete and long-term way. And I think with that, I will turn it back over to John.
Well, thanks, Kathryn, and thanks for all of our speakers. As we move to our next slide, we'll now turn to the question and answers, and thanks for all of you that have submitted questions so far, but please continue to write those into the box at the upper left-hand side. A couple things are very striking. One is that all of our speakers today talk about the importance of expanding past the usual suspects in aging, the folks we've historically worked with on aging programs, and also the need for long-range thought and funding. So here's the first question from one of our funder listeners, which is, how do we encourage our boards of directors to consider long-term grants and also grants that extend past what we usually think of as aging? And Pete, since you're also a part of the funder community, I'm going to aim that when you first, but we'll have our other folks jump in afterwards. So Pete?
I guess what comes to mind initially is sharing a vision of what's possible with long-term funding, and as in engaging them in the discussion. I think it's critical to engage your board of directors in similar discussions, and then through those discussions you can pick out individual board members that have aligned interests, and use them in future meetings to kind of advocate on behalf of longer term strategies through which older adults can benefit. So I think that's what I would say initially.
Any of our other speakers want to address that particular issue?
This is Cathy, and I used to be a program officer with one of our local foundations that focused on older adult grant making for our region, and actually they were kind of provided leadership, which sort of speaks to someone else's question. I think that mirror everything that Peter just said, because that's all important. I think that if you're a foundation that is used to funding direct services as opposed to long-term impact, I think it would be perhaps wise to consider whatever type of board education is going to be necessary, whether that's one meeting or whether it extends 6 months or even a whole year, depending on how long the foundation has been operating in a certain way, so that they truly understand long-term or impact grants, and possibly even find a foundation as a case study and ask them what kind of measures that they've put in place so that they could see successful movement forward. I think that was one of the most frustrating parts of our board initially, is that they were used to seeing outcomes in a fairly in a different way, that at the end of the grant period 360 people were able to read at a higher level, and this is just not that kind of grant making. So perhaps look at another foundation and as a case study, but the other, I think, would be to help your boards determine what would be the measures that would be meaningful for them, so that they felt good that this work was achieving some outcomes.
Well, thanks. I know there's a lot more advice from our other speakers, but I want to continue on with the questions. And this one is, do the projects that you're working on have an intentional focus on low-income and diverse communities? And I think I'll start with Amy on that one, and then we'll have other people jump in.
Great. Thanks, John. And the answer is yes. We need to, if we're going to be age-friendly and better connect older adults to people of all generations, then we need to be connecting all older adults, not just at one end of the spectrum or the other. And so, for example, one of our pilot sites, Central Village, was very purposefully targeted to one particular neighborhood because it was very income diverse, and it included older adults with lower incomes as well as those with more financial means. And they're able to establish some great connections between people that might not ever meet each other or talk with each other otherwise. And so the work has been very important and really driven by a demographic analysis right at the very beginning of the work within each community.
Anyone else want to address that issue?
I think it's the expectation of the community as well. That's certainly what we have found in Atlanta, that when we talk about all people, as Amy said, we're talking about all people, and any time that is not apparent or clear, that is immediately the question that we get from the community, is making sure it's available for all people. And so often when we're talking about issues of mobility in the community or access to the right kind of housing, this is a question of affordability, and largely that's where our efforts have focused.
Okay. Anyone else on that one?
This is Pete from Health Foundation of South Florida. I would just say that when you look at the numbers here, at least in the South Florida area, there are larger numbers of lower income older adults than higher income older adults. So that helps us focus on lower to moderate income older adults.
Right. Our next question is about the change process, and to some degree it's following up on a number of things that you've already touched on, which is that, particularly as local governments and local foundations have had to address not only the impact of the recession, but just the general decrease in funding for what we've traditionally thought of as human service programs. everybody's gone through strategic planning probably 3 or 4 times. Everybody's done all this stuff. And what the questioner asks is, everybody has change fatigue. So how do you deal with this issue in your community where people feel like, we've been over this and over this and over this. How do we get this moving, and how do we get it started? So let me start with Phil on that one, and then we'll turn to everybody else.
Well, I think what we're trying to do is to tie into a larger community development process that is very official in the sense that it will result in a comprehensive plan and then substantive changes in zoning to help us reach our goals. It will happen again in 10 years, and people do get tired through the process, partly due to its inherent delays. But I think if we were trying to do this alone without tying into existing change processes, it would be much more difficult.
Others?
Hi, it's Amy again. I think it's been extremely important to show small successes and to celebrate those, to really be able to demonstrate credibility within the project and with the partners, and then to be able to carry that forward to build up more momentum for the next steps and then the next steps. And also we found that goodwill only goes so far, so partners will only remain committed if there's a mutual benefit. And so we're very strategic about figuring out how to respond to and then deliver that mutual benefit to each of the partners involved. And that helps us work past that change fatigue because people believe in the process and then they benefit from the process.
And this is Cathy. We have found with every community that we've worked with that an intentional way to bring the demographic change to them, believe it or not, there's still, I didn't know this. So I think that this was somewhat rejuvenating to them, that this was new information and a way that they could view their communities as becoming more vibrant in a way that they hadn't considered it before. And with our recognition program, it requires them to really engage other partners outside of the city. And it also requires them to have conversations with their colleagues in other departments that they've not had within this context before. So the communities that we've been piloting this work with, we really see kind of an increase of their enthusiasm through collaboration and in looking outside themselves at the community partners that can assist them.
Right. One of the questions that's come up several times from our questioners is where do we find good resources on these issues? I will throw in a plug for a reference that you see listed in the chat box, that the GIA website has a number of resources under the community agenda area that are helpful in terms of beginning. But are there other, resources that you have found that have been particularly helpful in terms of doing your work as you move forward? And Kathryn, I'll start with you, and I'll let others jump in after that.
I would say it's a mix of two things that we found most helpful in Atlanta. One, who's willing to help us invest in some of the research and development work, some of the front end to figure out, well, we know the kinds of things we need to change in the community. We need some people to invest in how we make that change happen. And that has come for us in a wide variety of forms, including a grant from the Administration on Community Living, some early Ross funding a number of years ago, and as we begin to move beyond July, some 3-year CDC funding. So it's as well as some local community foundation funding. Actually, each time we had that funding, we also had the local community foundation funding. So it's been very important to have a variety of those sources, and really those have aligned based on the kind of change we wanted to test and understand. But each time also, every effort was designed then to impact longer-term, more permanent, regular, and often governmental funding sources, so that we knew from the start what we were trying to steer in a slightly different direction, whether that was local county dollars, city dollars, or even federal transportation dollars. So it's really had to be a combination of the two, and I think that it has helped make sure that what we call the R&D work hasn't been the beginning and the end. It has really, truly been the beginning for longer-term change. And while each of the specifics of those pots have been different each time, we've needed the same two types of funding to get anything done.
Anyone else want to respond to that one?
I would say echo. I'm sorry.
I would just very briefly just echo that Grantmakers in Aging is a terrific source.
Bill?
I was going to say that since much of this work is non-traditional and that it doesn't focus on necessarily on specific services, but on community development and quality of life for everybody, I have been particularly assisted by work in the field of the arts and humanities, where those are used as tools for community development, for community engagement and community reflection, because I think a lot of this work needs to emerge from a specific set of values about the role and the contributions of older adults, and I think the arts and the humanities can really help us in that regard.
Thanks. It's a great suggestion. I have one last question from our audience before, unfortunately, we have to move to your final comments. But that's a great general question, which is, you've all had a lot of experience in this area. What would be your advice to funders on how to do this work most effectively if they wanted to engage in their own local communities? And Amy, let's start with you.
Great. Thank you, John. I would really recommend to reach out to those who the partners that they see getting things done, that they can leverage, that they can embed this work within. It doesn't necessarily have to be the traditional partner. It doesn't even necessarily have to be their prime area of focus. For example, with us at MAG, a lot of what we do is transportation, which Piper does not fund, but older adults need transportation. And so there's all different kinds of ways to intersect the work and then to align the work. But I would look for the people who can leverage others and really approach them and explore together and really co-invent that process together.
Others?
This is Cathy. I think that for the foundation that I used to work with, to reach out to, well, the first thing we did was to join Grantmakers in Aging, and that was really very helpful to focus. And they were a really rich resource to us on a human level and in their resources. But if there are other foundations that you have relationships with, is to talk with them about what they're doing, and even if they've achieved impact in another area, to have some discussions with them about their strategy that could carry over to the impact that you want to achieve with older adults. So I think researching and understanding what it is that you want to do first, and seek out others to help you with that.
Great. I unfortunately now would like to turn to asking each of you to think about your final reflections for our audience today, and I will start with Amy and go down our list.
Great. Thank you, John. I'd like to share the words of one of our former leadership team members. She herself just retired and is kind of living her own encore career at this point. But her motto was always be brave and clunky. And I think both things are really important. That it's important to be brave, to take that first step, to reach out. But I think it's important to allow yourself to be clunky and to make mistakes, and then to learn from those and apply those lessons learned in the work moving forward. So be brave and clunky.
Pete?
I guess what I would say is that at least some of you may have heard of the term health in all policies. I think that we need to begin a discussion which pushes forward aging in all policies. And then I would also say that we have formed collaboration with individuals, local individuals and organizations that have been doing that health in all policy work here, and the translation, transferability, if you will, and the ability to get them to join this more aging-focused work has been very beneficial for us.
Thanks, Pete. Cathy?
This is long-range work. I think that's probably one of the first things that I would say, that it's not the short-term gains, although understanding that it is long range, to look for those short-term successes that would be meaningful to you. But I think looking back at what the Jewish Heritage Foundation did, actually they had very little money for grants in this area. But to consider that foundations can provide leadership to raise this as a critical issue with other funders, and that you can act as a convener on this issue without giving a lot of grants.
Great. Phil?
Yeah, quickly, two things. The first one is I'm beginning to think a little bit of money over a long period of time is preferable to a lot of money over a short period of time. But I think one of the other point I wanted to make is that in Indiana we're trying to characterize this as work in age and ability-friendly communities, and that's been very important in establishing connections with the disability community, which has resulted in a significant source of matching funds for these projects. And it's very important work, I think, to try to bridge that gulf also across aging and disability, and I think working on livability provides that opportunity.
Thanks. And Kathryn?
I think everyone has done such a nice job wrapping up. I can only echo a number of things, including that it is really hard to go into space where you're not comfortable, and I guess Amy's comment about being brave says it very well. But we have found over and over again that that people are very welcoming, even if they don't understand why you're there talking to them about issues. I think supporting Peter, that really understanding aging as a lens and not as the end in and of itself, make sure that the programs do not stand alone, but that they then integrate more holistically with others. And it has taken, I would also agree on the long term, it's taken a long time to build the communities that we have now, and it will take a long time to make them more relevant to this opportunity of longevity that we have. But there is so much that can be accomplished in the short term. I think Amy said it a couple questions ago, that's really where that momentum comes from, and that can provide a real difference tomorrow for someone's life. And there's good work to be done right now, even while you keep the long term in mind.
Well, certainly inspirational words from all of our speakers today. I want to thank Amy St. Peter of the Maricopa Association of Governments in Phoenix, Peter Wood of the Health Foundation of South Florida in Miami, Cathy Boyer-Shesol of the Mid-America Regional Council in Kansas City, Phil Stafford of the University of Indiana and the Indiana Grantmakers Alliance, and Kathryn Lawler from the Atlanta Regional Commission for all of their wonderful work to make life better for older adults throughout the country. They've all been associated with our great work on Community Agenda project, which is funded by the Pfizer Foundation. We thank them and also United Way Worldwide for their assistance and support in creating this funders group and sponsoring this webinar today. I do want to alert you that our next webinar for this group is on July the 9th, 2 o'clock Eastern Time. And this is on, in some ways, a follow-through to today's conversation on finding the best lead agency to make your community age-friendly. It's not always going to be the aging agency in your town or community. And how do you figure out what is the group that would move you forward the most effectively? I want to thank all of you for your interest in this topic and sticking with us today. And we wish you a great day.